I'd like to welcome the audience. Thanks to everybody for joining us. We had a great turnout. I'm Chris Bratton. I am the founder of Bratton Law Group. I'll be the moderator today. I have a very distinguished panel with us, so they'll be doing most of the talking and providing some great information. So we're in the middle of a very challenging time, even more so for our senior population who are very vulnerable to what's going on. And we, while we can't control the situation, we can certainly control how we respond to it, and all of our guests today will help us kind of get through that and kind of show us the direction and appropriate response. So our panel, start with Jackie Pelliccione is the executive director at Brandywine Living in Haddonfield. She earned her bachelor's degree in accounting from Rowan University, her MBA in healthcare administration from LaSalle University. Certainly serves as the treasurer on the board of the Tri-County Regional Ethics Committee. She's approaching her 15th year working at Brandywine. Thanks for joining us.
Thanks for having me.
Jared Rodgers is the chief executive of Life Force Senior Care since 2011. Life Force focuses on live-in personal care services in the state of New Jersey. He's a graduate of Penn State University, a Navy veteran, certified dementia practitioner. And in 2017, Jared was recognized by South Jersey Biz as 20 under 40 on the road to success. Dr. Chopra is the director of the New Jersey Institute for Successful Aging, professor and chair of the Department of Geriatrics and Gerontology at Rowan University School of Osteopathic Medicine, where she's the endowed chair in geriatrics. She's board certified internist geriatrician, certified medical director for long-term care, a fellow of the American College of Physicians, American Geriatric Society. She served on the board of directors of the Delaware Valley Alzheimer's Association, New Jersey Medical Directors Association, New Jersey Geriatric Society, Camden County chapter of the American Red Cross, Senior Citizens United Community Services, Thomas Alternative Daycare, as well as on several advisory committees in New Jersey Department of Health and Senior Services. She has a special interest in dementia with behavioral problems, pain management, end-of-life care, and long-term care, and is also published in these areas. She's consistently recognized as top doc by various New Jersey magazines and has a plethora of other awards that we would spend probably another 15 minutes going over.
I think you can skip that.
And last but not least, Dr. Scheinthal. He's a board-certified psychiatrist with subspecialty certification in geriatric psychiatry. He's professor of psychiatry and geriatrics and the chair of Rowan University School of Osteopathic Medicine, Department of Psychiatry. He's a distinguished fellow of both the American College of Osteopathic Neurologists and Psychiatrists and the American Psychiatric Association. Dr. Scheinthal is a graduate of UMB&J School of Medicine, now Rowan Medicine, where he completed his internship, psychiatry residency, and geriatric psychiatry fellowship. He's the recipient of a Geriatric Academic Career Award from the U.S. Department of Health and Human Services, Health Resources and Services Administration, past president of the American College of Osteopathic Neurologists and Psychiatrists. He was appointed by Governor Christie and served as co-chair of the New Jersey Alzheimer's Disease Commission from 2013 to 2016. Chief of Psychiatry for Jefferson Health, New Jersey, and currently serves as medical director for Specialty Care Nursing Facility, Pavilion at Silver Health, as well as a physician advisor for Arden Courts in Cherry Hill. And I would like to welcome you all, and it's my pleasure to have you on. I truly appreciate it, and I know our audience is going to appreciate it. We're also going to post this after, so this will be available to a number of people so they can really see what information you're able to provide and the guidance that you're able to provide. To the audience, you can ask questions via the Q&A tab or the chat tab. And at the end, we will address those questions. We'll try to leave 10 or 15 minutes. I know some of the panelists are on a time crunch, so we're going to try to keep it right to 12 o'clock and then let them go. So I'd like to start off with Dr. Chopra. So given the social distancing measures currently in place, what are the health challenges faced by older adults living in the community? What are you seeing?
So, I think Steve will be able to elaborate more on the mental health challenges. We are seeing a lot of lack of social support. Families are not able to visit their loved ones. So there is lack of informal as well as formal support. So those individuals, who were able to stay in their home, they were vulnerable, but they did have assistance from outside. So now I think it's going to make a difference between them staying at home versus going to assisted living or long-term care facilities. Other healthcare challenges, they can't go out that much. So there is a lack of exercise, which can lead to deconditioning, especially for older individuals who may have mild to moderate dementia. There is no cognitive stimulation right now. They can't really go to adult daycare. So they can actually get more confused and their cognitive function can deteriorate. Now, the other thing I have seen is that, patients are very afraid to go to healthcare facilities. So we actually worry that they are not going to be taking care of their chronic problems like hypertension or diabetes or heart failure because they are afraid. I mean, I even hear from my patients, they will say, well, I don't want to go to the hospital because I'm going to get COVID. So I do think that it's very important for us as healthcare providers to be in touch with our patients, try to educate them and assure them that the healthcare facilities are also taking precautions to make sure that they stay safe.
Right. And in that same vein, what can healthcare providers do to mitigate some of those healthcare challenges, whether it be that deconditioning or issues related to mental health, which we'll get to with Dr. Scheinthal. I'm sure he'll be able to speak on that in greater length.
Yeah, so, as you know, Medicare has relaxed a lot of rules related to telemedicine. Initially, we could do only telemedicine in rural areas, but right now, almost all our visits, both medical as well as psychiatric visits, can be done online, and lately Medicare did realize that some of our older patients, especially 80 plus, have difficulty with, smartphones or other technology. So they did approve that we could actually do telephone visits with the patients. So I think one thing is very important, that patients should know what healthcare options are available right now for them. They don't have to go to the patient's office, but they could actually get in touch with their physicians. And I think healthcare providers are also being proactive, that they are actually calling patients and checking on them to make sure that they are doing fine. We can also take that opportunity to educate our patients in terms of what precautions they need to do. We always encourage that they could do exercise, if they have internet availability. I mean, there are lots of online exercise programs that older individuals can follow. I mean, many have become very creative, that through Zoom or other platforms, they are able to participate in exercise programs, or even, get involved in like virtual dinners, so they can have contact with their friends. Now, the other thing I like to recommend to older people is that, they should be prepared. That's where healthcare providers or the staff from healthcare providers can educate them. So when a physician calls, we want to make sure that they have their hearing aids. They should have the list of their medications ready, so we can actually do a medication review. And then some of the patients have things to monitor their blood pressure, or they could take their temperature. So we are trying to educate our patients to make sure that these audio or video visits are actually more productive, and they can be done in a timely manner. The other important thing for healthcare providers is, and which maybe we didn't pay too much attention before when they came to the office, is that we should really ask about, like, what social support system do they have? Who can they reach out if they need help? Who is trying to get groceries for them? Can they actually, order food online? And making sure that their medications are up to date, that they don't run out of their prescriptions. And we also want to make sure that even though we are teaching them about COVID precautions that we also emphasize on them that, you still have to take care of your chronic problems like diabetes or hypertension or congestive heart failure, because what we don't want to happen is that they neglect those areas and then they're going to end up in the hospital.
Right. So we're seeing, especially toward the beginning of this, where there wasn't as much contact. The family couldn't get in touch with those family members that were in the facilities. So Dr. Scheinthal, with regard to those individuals that may have some cognitive impairment, what effect does that have on them not being able to communicate as much with their family or not being able to interact as much with other individuals? Does that have a detrimental effect on them?
It becomes very challenging for them. The isolation tends to increase, and they may experience, in some cases, a little bit more disorientation. For the patient living at home, very often they're getting very focused on the news, which can be even more distressing. It was bad enough with all the COVID news and the climbing numbers, but with the recent protests regarding the George Floyd situation, that can be very distressing for someone who has even mild cognitive impairment, and seeing some of the protests that spun out of control, they get fearful that that's going to happen to them or in their neighborhood, and really can add to the detrimental effect. I do want to go back to a couple things Dr. Chopra said, just to underscore, in the emergency departments, we actually saw older adults evaporate. People who were coming in usually with high blood pressure, with chest pain, with diabetes, they all vanished. And I think, to Dr. Chopra's point, these were patients and families afraid of getting COVID. But the illnesses didn't go away. They were just at home. And we don't know how many people may have had exacerbation of their illness, or worse, even died at home because they didn't get acute medical illnesses taken care of. I think one of the other things that I'm seeing often gets missed, and Dr. Chopra said it, I'm just going to paraphrase it, is that you have to be flexible when caring for or looking at care for older adults. We as healthcare providers have to be flexible as well, because one size doesn't fit all. I'm actually amazed at how many of my patients don't have internet access, don't own a smartphone. And these are things that are commonplace to all of us, but may not be commonplace. I treat someone who's a professional, retired professional, no internet access, which really was very surprising to me, but I think more the reality than perhaps we all think about. We tend to look at older adults as a lump group and think of them as very homogeneous, but they're actually very disparate. And even to go back to your question, patients who have cognitive impairment, some people may be totally fine at home. Some people may be very anxious when they're looking at the news or because of the isolation. Other people kind of like the quiet of not having all the access. I think the other thing that I'm starting to see, even in higher functioning patients, and it can be a little comedic at times too. There was a great SNL skit about this called Silver Alexis. If anyone wants to Google that, it's very funny. But the difficulty that some older adults have in mediums just like Zoom or WebEx or Microsoft Teams, I don't own any stock in any of these, but in all of these online platforms, they can be very challenging. They may be able to get audio but not the video not audio. They don't understand how to mute. They don't understand why they're talking and no one hears them. And these are highly educated people. These can be very challenging things that we are all taking for granted, but in many ways, this is a brave new world for all of us.
Very good. Jared, what challenges are you seeing faced by families that are trying to keep their loved ones at home? I think you're muted, Jared.
So going back to the family support system, especially in the very beginning when when everything happened, we provided quick reminders to our home health aides the importance of following infection control protocols. These are things that they're trained on a regular basis, and we always had to be reminded on these things. And this is something that I learned years ago, just being in the military, just being trained on the same thing every day. And now I understand more why than ever. The other thing too is when we had to, the other education we provided is to families saying, okay, this isn't really the best time to go see your mom or your dad. And that was a tough thing to really educate the families on. But I think a lot of people were in agreement with that. So that really took away our support system, family support system. And I think what that enlightened me is how much we really utilize the family. As you mentioned, someone mentioned about grocery shopping and doing errands and picking up medications, going to doctor's appointments. So now they're looking for other avenues of being able to do that. So those are some of the challenges that we dealt with. The other big challenge that we dealt with very early on was the PPE. We never had an abundant supply of it because we didn't need to. We just pick up the phone, ordered the materials, and it was there within a day or two. So that was very enlightening. It really it emphasized a lot of things that Life Force was doing well, but it also exposed some of our weak areas, and that was one of the biggest weak areas. Having masks, we rarely needed masks. We take care of clients with C. diff, we take care of clients with MRSA, then we need the full gowns and protection. But it's a very rare situation. So it just really kind of, that was the biggest challenge, was getting the PPE equipment. And the other thing too is I dealt with a lot of anxiety among caregivers. What does this mean? How am I protected? So not only did we have to work with the anxiety of the family, but we had to work with the dynamic of the anxiety of the home health aides. And when everything started to unfold, even to office staff, and my strategy was I kept them as busy as possible to not focus on the anxiety, but just to focus on different tasks. So the biggest challenge, like I said, was working with people's anxiety, losing the family support system, and just emphasizing some weak areas, which for us was the PPE, which we've been able to resolve.
Are there certain safety measures that have to be followed as they're coming, if they're being discharged from hospital or rehab, and then coming home, and then you have a caregiver coming in, obviously, and your company focuses on 24/7 care? What are some safety precautions that have to be in place?
So how Life Force is handled, I'll give you a specific example. We had a client up in Long Branch that was being discharged from the hospital with pancreatic cancer. He was a physician, a medical professional himself, was starting hospice, and his elderly wife was also at home. So what we did in terms of the caregiver aspect is we followed the procedure at the time, which was taking the temperature, putting masks, making sure they have masks, making sure they have gloves. But what we did was we took it a little step further. We created an isolation room for this particular gentleman. He did not have COVID. He tested negative each and every time. But you don't know, when being transitioned from the hospital to home so early on, you didn't know what to expect. He did have C. diff, which is a whole different aspect of the care. But we did put an isolation room that had direct access to the outside. So we prevented the visiting nurses from being able to have full access to the house. They only had really access to one room. My main concern was the wife, because it would be a hard thing to deal with if the wife wasn't able to be there for her husband. And he did pass away a few weeks later, but my emphasis was to protect the caregiver and his wife so they could stay together through this tough time. So when the caregiver came in the home, the caregiver continued to wear her mask. She took her temperature every day. The wife did the same thing. She wore her masks anytime they're interacting. And it's tough too, because the other challenge was the wife and the husband interacting, because they were married for 60 plus years, and they would lay in bed with each other, talk to each other, and to tell her, okay, well, you have to change the way you interact with your husband. You can't just come in and fully expose yourself, because now you're putting yourself at risk. So we did put a lot of safety measures, and we've been very fortunate, but that's how we've been able to kind of handle it, and making sure that families stay fully masked, and asking, putting signs outside the house that says, if you're entering this house, please wear the masks, just to provide that education.
And Jackie, there's obviously a lot of concern about safety and well-being, and facilities have really been hit hard on this. So how do you address the concerns of family members who are searching for a safe facility that can care for their loved one?
It is challenging. At one point before all of this, assisted living was a safe place, where residents would come and we would oversee the care, the programming, proper nutrition. And now, the media, and it's just facts that this type of virus and most types of illnesses can travel very fast through a facility. Families are questioning, and luckily we still have a line of depositors that still want to move in, but we're getting posed the question of, is this still the safe place for mom? Yes, maybe when it comes to falls, and we make sure they're doing these telehealth visits and they're eating properly, and we're able to oversee, they're still able to participate and exercise safely. But when it comes to an illness like this and the spreading of that illness, it is very challenging. And I think people are questioning, is this still the safe place for my loved ones? And we just reiterate to people that, we can still offer the programming safely that they need, the isolation of being at home, that depression. Things have changed, obviously, right now. We have to be very careful of how many individuals we let into a group for programming, but we're still able to oversee that healthcare. We just introduced therapy back into the building, which is huge. Residents that aren't able to move due to the lack of therapy, bringing that back in for the last 2 weeks, you've seen a vast improvement and change for some residents. The FaceTiming, I have employees here that spend all day FaceTiming with families. They can still see their loved one. They can still interact. We do Zoom calls with a large group of families for birthdays, things like that. So that cognitive stimulation, the physical stimulation, we're still able to safely offer, even though that has changed a bit. We can still offer it to a point.
All right. So Dr. Scheinthal, along those same lines, what are some important things for families to know when they are trying to select a long-term care facility?
I think it's very hard to look at the numbers and the infection rates and make a decision based on that, because there are a lot of variables that went into those rates. And I think the New York Times put out a very comprehensive article that listed infection rates by facilities and even deaths. But that doesn't tell the whole story. And even if you're on covid19.nj.gov, that doesn't tell you the whole story about the facility. I think you want to look at, how does the facility handle when an infection breaks out? You want to look at, what is the availability of physician services in those buildings? What have they done in terms of safeguarding and education of staff? Because the reality is, and one of the things that I find very frustrating, both in my listening to the media, but also in patient reportings, is there's so much misinformation going on. I mean, just this morning I was driving in, and I listened to a particular station, and I heard the disc jockey saying that it's over, that COVID's done, take off your masks, you can go back to everything. And, it's just so irresponsible. And facilities are dealing with families who are hearing this irresponsible type of information. And, if a facility is screening, if a facility is really going above and beyond to make sure that they're watching if visitors are coming in. Most facilities are still closed to visitors at this point in time, but some have opened up. You may want to ask also, how has your staff been educated regarding use of PPE and infection control? You may want to ask, but not necessarily always telling, what's the use of per diem staff, because visiting nurses and others may be going from building to building and may be spreading. But some of that now is very hard to control, because as facilities have staff that get sick, look, you can get sick going to your local supermarket or convenience store. This isn't a mark that the facility is a problem. And you have to weigh that if a facility had, 6 staff members that got sick, perhaps in the community, and they need to bring in temporary staff, that's not that the facility is doing something wrong. It's much more challenging in selecting a facility today than it was 4 months ago. And the good facilities 4 months ago were still good facilities. I don't think that has changed. I think one of the other things that's challenging is that many facilities are no longer accepting patients to try to control their rates. And I think that's a mixed blessing, because on the one hand, they're trying to protect the patients and the staff in the building. On the other hand, if your loved one's in a hospital, their risk of infection is probably greater than it would be if they were at home. So it's a very hard balancing act. Just this week, I'm starting to see more facilities opening up, but I'm still hearing from case management in the hospital, can you make a call? So-and-so at this building, we can't get so-and-so back to the building. And, I think facilities are doing the best jobs that they can in very challenging time. I think, Jared made a good point. They've been really good about PPE, but this wasn't really something on the radar for many facilities, and not a message of good facility versus bad facility. I think this pandemic caught everyone pretty much off guard.
Yeah. So if I can just add to that, I agree what has been said. I mean, I think initially the lot of attention was paid on the hospitals, because they were thinking that there was going to be a surge of patients coming to the hospital. And there was not really any emphasis on nursing homes or assisted living facilities, where you had more vulnerable older patients and they were at higher risk, and no resources were put in there. So I think that's one of the reasons that I think we had a huge number of patients with COVID positive in both assisted living and long-term care facilities, because, they are really a setup for an environment where the virus can spread very easily. And I always say, listen, the virus was brought from outside, whether it was from visitors or it was from the workers who were working here. But now, we are where we are. I think the nursing homes are adapting to that. Lately, the New Jersey Department of Health, like many other states, are actually mandating that all residents and staff have to be tested. Yeah. In fact, before May 30th, they had to be tested and then retested in 3 to 7 days. And after that, they gave the option to long-term care facilities to determine how often they have to do retesting. Because the goal here is that we need to identify people who are positive, because even in the nursing home setting, many patients were asymptomatic and they still came back positive. So the goal now is that we should identify workers as well as patients who are positive, try to isolate them with all the infection control procedures, and eventually get down the facilities to being zero as far as COVID is concerned. So, and the other thing is that, the nursing homes were kind of caught by surprise. And there have been studies published which show that there is actually have been no relationship with the star rating versus how the facility actually has done with dealing with COVID. So I think it was just not much attention, no provision of PPE. They were taken by totally off guard, and we had huge number of patients who actually, developed COVID in the nursing home. But I do think that, it is going down right now. I think they have become more aware, more PPE is available, as it was mentioned before. So I think things are improving.
So in that same vein, though, so let's say someone does test positive and they're in a facility. What's the best measures for the facility to take at that point to ensure the safety of that patient, but also those other individuals that are interacting with that patient, so that they don't then spread it to everyone else in the facility? You mentioned isolation.
Go ahead.
Main problem has been in the long-term care facilities is not enough education on infection control. So, you know, we have many physicians who actually work in the nursing homes, and I generally hold meetings with them every week. And initially they were telling me that even the staff, you know, would not wear a mask or wear mask properly. You know, it would be just like hanging around their neck. And I don't think that people were that well educated on infection control or how rapidly this virus can spread. I think with time, people have become more knowledgeable. So, you know, if a family has to place somebody in the nursing home, I think they need to ask, like, listen, what is your screening policy? What is your quarantine policy, that if somebody comes back positive, what do you do with them? And how are you actually reducing the infection risk? And what would happen to the older person when they have COVID? Are they going to be isolated in a unit? If they go back to the hospital, are you willing to bring those, you know, individuals back? So I think those are all the questions that families should be asking the facilities before they actually place their loved one in a facility.
Jackie, how are you guys handling that?
And I think with that, on top of that, it's the education, you know, and it's funny, residents who are in their 90s will say, nobody's ever been through something like this. You know, this is all new. And we're very blessed, Brandywine's very blessed with the corporate support we have. And we have a very structured training program with PPE, with isolation. And I think also on top of that, it's educating the staff on the social responsibility they have when they leave the building, when they go home, when they go to the grocery store, when they choose to hang out with family and friends, and that your job is so vital that that can really have a detrimental effect on how you handle yourself outside of here. And you have an important role, and you have the ability to really cause some serious harm if you're not careful when you walk out these doors. Yes, your PPE is vital here, but when you leave, that has to continue, because what the potential of bringing something into this building, and it's going to come from one of us. Family members are not visiting, you know, residents have been isolated properly. It's going to come from a staff member. So we have to be very, very careful of how we handle ourselves outside of the community.
Right. Dr. Scheinthal, there's been a lot in the news about the mental health aspect of this and the potential mortality regarding that versus the mortality of the virus itself. So how do families weigh that potential health risk versus the mental, you know, slide, especially with someone who may have some type of cognitive impairment?
It's a really great question, Chris. And unfortunately, the mental health aspects of this virus continue to unfold, and we don't yet know the full picture. So there's the anxiety of, am I going to catch the virus? Is my loved one going to catch the virus? There's that aspect. There's also the whole aspect of the lack of real understanding of people who are positive in the community, but also in facilities, who are asymptomatic but positive. And the anxiety that brings for someone who may have more cognitive awareness and their families of, is this fatal? Am I going to get sicker? Or is this just going to be, I'm a carrier or I'm positive? And we don't even know if they're carriers and what that transmission rate looks like. And I've seen some really good management of patients who are asymptomatic but positive in general. But what we are seeing is patients who are positive starting to present with depression, symptomatic patients with disproportionate amounts of agitation and behavioral problems, so that someone who may or may not have had an agitated dementia is now much more agitated and combative than they ever were before. And the literature seems to be pointing to that this is a byproduct of the disease, but we don't understand why that is. We don't understand why some people are seeing depression and anxiety who are symptomatic and others are not. I think what we think we understand is the asymptomatic patient who's having depression and anxiety because they're scared. But it is a very, not well understood disease. Someone I heard recently talked about this, and if we remember baseball, if that ever comes back in 2020, that we would be at the top of the second inning, that we really we're not far along in this disease process to understand it well enough to be able to make an interpretation.
So I'd like to add something to that, if you don't mind. In regard to mental health, and from my understanding, I'm a home care agency, but my understanding is the two costly things to a healthcare system is end of life and mental health. And I think we're going to see a huge spike in that very soon. Again, as it was mentioned, I was in the military, and when you go in the military, you expect tragedy at a drastic level. These nurses weren't expecting that. They weren't expecting to make a decision that this person's going to make it and this person's not. And there's already been nurses who, before all this, who made decisions that really weighed on them. And I think you're going to see that more now. And that's the important thing, that it's always been my message with LifeForce, is keeping our staff holistic, because I don't need broken people taking care of broken people. And I'm sorry if that's not the right term, but that's why we had a social worker on staff, and we still have her on staff, is to really check in. And before COVID, we would work with, we find out that some of our staff were fighting depression. We actually had one that had suicidal thoughts. We pulled her out of the case right away, got her to see help immediately. Domestic abuse. But right now, we're seeing it right now. We had a situation where a caregiver, you can tell she's exhausted, because when this all started, everyone kind of stayed put, but we have to kind of intervene. So we have to be on alert, and it's a challenge because ourselves are dealing with our own issues at home. My son, who's 8 years old, I can see that he hasn't been able to go to school. That's a mental effect on him. I have to get involved with that. So now I have to deal with this issue at home, plus come to work and keep myself in check. So we have to really find great programs to keep our mental state in check so we can help other people, because if we're not, our clients are going to get through it. So that's something that we've been really trying to emphasize, checking in with our staff. How are you mentally doing? Because like I said, if they're of sound mind, then they can provide that quality of care to our patients.
Yeah,
very good point.
Jared, that's a great point, and it's actually more difficult now for some staff in the face of the whole George Floyd situation, because many people are dealing with depression and frustration over the protests, and it's making the COVID situation more cumbersome for staff. And I think that's a wonderful service, Jared, that you guys have internally. I want to remind everyone that's listening that every county in New Jersey has a psychiatric emergency service, and they have a 24-hour hotline. And you shouldn't feel that you have to go into the hospital to get the service, but there are counselors available in all the counties who can talk to you on the phone 24 hours a day. So at no point should a New Jerseyan feel alone.
And I think when this all started, very beginning, it was affecting the elderly, and the fatalities were the elderly. And as this evolved, you were hearing about younger people, healthy people, and my staff were saying to themselves, I'm putting my life on the line, my kids' life on the line for residents, and just kind of constantly the morale in the community. And they're heroes, and you hear about the heroes on TV, doctors and nurses in hospitals. Yes. The real MVPs, the real heroes, are these aides and these nurses in these facilities that are putting their 30-year-old lives or their kids' lives on the line for, And it's, why am I still doing this? For a paycheck, and they're here for the right reasons. They're warriors, they're champions. And I think kind of keeping like Jared said, keeping and making sure their mental health and they're physically able. It's a challenge. It's a challenge.
That's a very good point. So to the doctors, is there a way to be better prepared for a future if there's another pandemic that comes through, and not just for the elderly, but if it has a greater mortality rate across all age demographics? Is there anything that we should be doing now that we've learned or starting to learn something from this?
Well, I think we have learned some hard lessons through this. There's so many issues, I think, at the national level as well as local level. I mean, the fact of the matter is that we were totally unprepared for this. You know, for such an advanced country, richest country in the world, and not to have 25-cent or 5-cent mask available, I think is just so, disheartening. So I do think that we have learned a lot. We have to be better prepared because there are going to be more, these infections or pandemics. It could happen. I mean, I think people were just hit really hard because they could never think anything like this happened. And, you know, some of my patients who are in their 80s and 90s, I mean, even they say that they have never seen anything like this. So I think both at a national level, state level, local level, at the facility level, that we all have to become better prepared for future. I think we have learned some hard lessons.
Yeah, I would agree, and not to steal Jared's thunder on this, but I think we have to be ever vigilant.
Yeah.
I don't think we can let our guard down in our office practices, and certainly not in our facilities, in terms of doing infection control training, making sure that we have enough PPE in facilities, making sure staff understand the safety aspects, educating families that there may be points in time that the facility may have to shut down, and to visitors for patient safety. And I think we have to communicate better. I think physicians, line staff, administration, I think we get very isolated at times. And I think one of the things certainly Dr. Chopra and I know very well is that to do geriatrics well, it's a team, and it's not one member of the team. And from a psychiatric perspective, if I'm coming in or anyone in the gero-psych department is coming in and not talking to staff, we're not doing a good job. And you know, to do this well, it takes everyone on this call working together.
Right. This question is for everyone. We'll start, Jackie, we'll start with you again.
Okay.
So do you see this as a new norm in your field or the services that you're providing? How is that affecting how you perform your day-to-day? What are you doing to provide education to the community moving forward, whether that be precautionary or for preparedness? And can you provide any words of wisdom to everybody moving forward?
I know, you know, we sit there and say, is this the new norm? And I hate to admit it, but I have feeling that yes, I think a certain procedures are definitely going to be the new norm. We have to be prepared for anything. I think this has gotten us so prepared. We were caught off guard, and I think we've learned so much from this. And I think just, you know, reassuring families that, you know, this still is a safe place. You know, yes, we've learned from this. Yes, we've made mistakes. And yes, the most challenging time, you know, any facility has probably ever been through, but we learned from this, you know, and that's how you grow, you know, that's how you grow, and that's how you do things better. And, you know, again, you know, it's all about the support you have, and we're very blessed with the support system we have at a corporate level to help us educate and train. And, you know, Brandywine is one of 30 buildings, and every building has gone through something different, and we're very open and we talk about things. And I think everybody just needs to be very honest and open and learn from each other, and just kind of start a new normal and still be able to provide the services that these residents need to thrive, and do it safely. And
Jared,
I
how about you?
Say again?
How about you? What do you see this as, and how, you know, moving forward, what kind of education are you providing to your patients, your staff, again, to be prepared and for precautionary reasons?
So I've always been a big believer on doing training in the office because I love that interaction. You really get a sense of, are they retaining the information? Are they really understanding? Are they just going through the motion? And so one of the things that we've done very quickly was revamped our training like quickly. So we got some good online training so people can continue to do that training. So it changed the way that we do training, and it was a fight because my staff know how important it is for me to bring people into the office, but it was the right thing to do, and the aides really appreciate it and were very receptive. So it really vamped up our training, which has always been good. We've been doing it for a long time, even before other home care agencies started doing such a thing. In terms of, I think it also, for example, screening. We now screen, because LifeForce actually transports their caregivers to and from cases. So we have drivers that actually drive them. So our drivers will hand them the equipment to screen themselves. We haven't done that before COVID-19. And the question is, why not? Because the reality is, if a caregiver has a fever and they go to the client's house, even if it's not COVID, they're putting that patient at risk. And we've all done it. You know, we're not feeling well, but we still show up to work. And that can be very detrimental, especially with the population that we take care of. So if anything, it has really helped us to step up our game as an agency and as a healthcare provider. And it has really, again, helped us to identify some areas of opportunity for us that we've been able to emphasize on. And that's the other thing was communication. I'm a big believer on setting right expectations and communication. If you want to be successful in healthcare, if you can master those two things, you'll do extremely well. Setting those expectations and communicating. But it has helped us even do better. We found that we were communicating well with the caregivers, but we could be better with the clients. So it really helped to improve our system more than anything. You can say new normal, the new norm, and I understand that phrase, but I really, it's some of the stuff is like, we should have been doing this in the first place. Let's do it now.
Yeah, Dr. Scheinthal, has anything changed for you moving forward in how you're dealing with patients?
I think a lot more flexibility. I have some patients who really are missing the live interaction and they're looking forward to coming back, and there are other patients that enjoy the convenience of teleservices. You know, the interesting aspect, which Dr. Chopra and I didn't touch on, is when you're doing tele, it's like doing a home visit. You're getting a little glimpse into what's going on in their home as well, and what they have in terms of services or not services. But again, it's about flexibility, and one size doesn't fit all. And that's always been true in geriatrics, but I think it really came to the forefront through this crisis.
Yeah, Dr. Chopra, is that, I think maybe one of the positive things that have come out of that is the telemedicine, and do you see that continuing on?
Yeah, I mean, I think, a lot of time when you have these challenges, I also think that there are opportunities for us. So I agree with you that we hope that the telemedicine is going to continue. Now, there are definitely situations where you have to see patients face to face. I mean, I have had some patients, where they say, well, I like to come and see you face to face. So I think we do have to continue that, but then there are instances where I think telemedicine could be very beneficial. I think one of the biggest challenges that we have faced with telemedicine is, especially with the video technology, is that many older individuals, especially like 80 plus, they are not used to these, technological platforms. So one thing, my advice to families, because, I mean, even your grandchildren, I mean, they are a lot more tuned to this technology, but they have to have some patience to teach the older individual. So sometimes, they are too fast, and older people can learn. It's not that they don't have the ability to learn, but they actually take longer time to learn. So you really have to physically show them or have them try in front of you to make sure that this, communication platform, the technological platform, that we actually get them a lot better at that. So one of the things, what we are doing is that focusing on educating the patients as well as families. Sometimes they can use a family member to help them. So in the event that even in future that we have any pandemic, that we have to provide care to them, that we could actually do that. So now we also have a home visit program, where we have about 350 patients in the house calls program. And also our physicians have been providing to assisted living facilities. And I have to say that assisted living facilities have been very supportive, in the sense that even when you're doing telemedicine, you can't really depend on the patient in the assisted living facility to actually do the video visit. So the staff has been able to help with the iPad or iPhone, and you are able to actually connect with the patient. So I hope that this telemedicine will stay. It's not that it can replace the face-to-face visits, but it can actually help. And then I think we also have to start to focus on that. What are the important elements in the telemedicine visit? We want to make sure that we are reviewing patients' medications. As Steve mentioned, sometimes it's very nice to see like what their home environment is, because you really get a better idea as to what is happening to the patient in their home setting. We also have seen that family members are very appreciative, because it used to take them, when we used to have family meeting, everybody would have to take time off and they would have to come to the office. And now we are offering that option to them, that they can actually join either by Zoom or Skype. So I think that it is beneficial to the patients as well as to the caregivers. But we have to educate our older people on the use of technology. I think people who are between the age of 60s and maybe 75 are a lot more savvy with that. But I think our really older population is not that savvy. Now, I think there was a question related to end-of-life care, and that I think is really important because many people do have advanced directives, and with all due respect to lawyers, sometimes these advanced directives are done between the lawyers and the patients and the physicians, and it's the fault of the physicians too, because they are not actively engaged in discussing end-of-life care with the patients. It's very important for us to know what matters to the patient, what is actually important to them. I mean, is it longevity? Is it maintaining independence? I mean, what are the choices that they are going to make? So in these situations, when we have to make end-of-life care decisions, it's really important for the providers to know that we need to have those discussions. And Medicare actually allows for advanced care planning, but not many people take advantage of that. So I think it has really stressed on us the importance of some of these things, which are so critical in taking care of older patients.
Right. I think that's a great point. We can try to stress education to our clients to make sure that they have their documents in place and their living will and the pulse, but we can talk to them about it, but what does that mean to them from the medical standpoint? And I think the physicians really should get involved.
Right.
So we do have a question, maybe more towards Jackie, maybe the doctors. What does social distancing look like in a memory care unit at this point? And what does the future hold for memory units?
Very challenging. It's by far probably the most challenging issue in this environment. Residents are used to being together. The memory care residents, that's how they thrive, in large groups together, socializing. So keeping that distance has been very challenging and safe. I mean, you can't lock a resident with memory impairment in her apartment. It's just not safe. So being able to open the doors and constantly checking on residents and rotating residents in small groups for activities. Of course you're going to have the residents that are just going to continue to move around the neighborhood and in the unit, and you have to safely provide that space for them. Masks, wear a mask. And I'm not wearing, it's very challenging to have a resident wear a mask. So it is, and the amount of staff that's required up there, we brought in additional staff to help with safety. The in-room visits, the in-room programming has been huge. So that is definitely a huge challenge, is keeping residents isolated safely and reflections in our dementia unit.
All right, we are out of time. Does anyone else have anything to add before we go? I want to thank each and every one of you very much for the time that you've given us. I know your time is very valuable. You provided a lot of great information to the audience. This will also be posted, so hopefully, a ton of people will be taking a look at this and will receive some benefit from the information you've provided. I will get with each of the panelists after, and if they okay it, I'll link their their contact information whenever we post it. I just want to get their permission first. Again, thank you very much. We certainly enjoyed it. Dr. Chopra, Dr. Scheinthal, Jared, Jackie, we truly appreciate it. You guys stay safe. Thank you again.
Thank you.
Thank you guys. See
Bye,
ya.
everyone.
Bye.